First, Omni Family Health provides quality healthcare services throughout Kern, Kings, Tulare, and Fresno counties. Getting proper care is especially important with COVID concerns ongoing. But the coronavirus may not just impact someone's physical health. Some might find themselves not only battling the virus, but also things like addiction. And Omni Family Health can also help with that. And now we would like to welcome Dr. Grace Tidwell. She is the Associate Medical Director for Omni Family Health and the founder of Omni's Medication Treatment for Addiction program. Dr. Tidwell, thank you so much for joining us today.
Happy to be here.
Yeah, so okay, just before the pandemic took over, I feel like in the news cycle, we were hearing so much about the opioid epidemic. We were hearing about fentanyl. We were having really important conversations. And then the pandemic happened, and that kind of took over the news cycle. So what have you seen in the world of addiction since the pandemic started?
Yeah, thank you. I think you're absolutely right. I think the pandemic took over all of our attention, which needed to at the time. But unfortunately, what we've seen has happened is overdoses have really increased during this time period. I think there's probably a lot of reasons for that, but data's just come out showing that nationally, drug overdoses are up by about 24% in the past year. And in California, that number is around 30%. So it's pretty substantial.
And that's kind of wild to think about because in 2019, we were already seeing a huge increase in overdoses. So can you put that in perspective for us? And can you kind of maybe paint a picture of how California fits in with that national conversation about overdoses?
Yeah, absolutely. So, during the pandemic, I think there are a lot of reasons why we might see increases in drug use. People are under a lot of stress. There's a lot of despair. And then the biggest thing that we've seen that's contributed to this, and especially in California, is that there are more synthetic opioids out there. And what I mean by that is there's more fentanyl, and often folks don't even know that it's in what they're using. We've seen in many states overdoses related to synthetic opioids are the big driver of the increase in overdose deaths. In California, especially, that's been true. We've seen a rise in over 50% of overdose deaths that are associated with synthetic opioids.
And when we say, there's a 50% increase, it's not like going from 2 to 4. I mean, the overdoses were already rising in 2019, and they were, unlike anything we had ever seen before. Is that an accurate statement?
Absolutely. So 81,000 people died of drug overdoses last year. 81,000 in the United States.
And so what are some treatments? What's out there? What can people do?
I think that's the most important thing for us to know, that there is good treatment. It's available, especially in California. Treatments for drug use are paid for by Medi-Cal, by Medicare, by your private insurance plans, and so it is out there. It depends on which drug we're talking about. If we're talking about overdoses and opioids, there's treatment out there with Suboxone, with methadone, with other medication treatments, in addition to your traditional therapy and groups. We know that these medication treatments are highly effective and really are the best thing we have. And we're trying to increase the availability of these treatments at Omni.
And I think for people, maybe they've never taken an opioid or they don't have any interaction with opioids, they've never run into it, they kind of feel, like, what can I do? And Narcan is a great option. Can you tell us about that?
Yeah, absolutely. So there's a few things you can do. One thing is, do not keep leftover drugs in your house. I cannot tell you how many times I've had a patient tell me that it all started when they took leftover pain pills from their parents' medicine cabinet, from their friend's parents' medicine cabinet, from my aunt or uncle. I will not keep those substances in my house because you never know who's going to be over and might, look through your medicine cabinet. It's really important that these are properly disposed of. Don't keep those leftovers for a rainy day because you don't know whose hands they're going to end up in. And then the next thing is Narcan, which I've actually got some right here. I carry this with me. All of us can actually carry it with us. You can either get a prescription from a doctor, or many participating pharmacies will offer it without a prescription. And so what I have here is it's just it's a nose spray, so you put it together and you're able to use it as a nose spray. And it is the antidote to an opioid overdose. This has saved so many lives. And having it available readily, so anyone that uses any opioids or just anyone in general, this is a good thing to have on hand. And then recognizing the signs of an overdose. So somebody who's, not really responsive, if they have slow breathing or aren't breathing, if their pupils look small, especially if you're seeing blue lips, blue nails, their skin is cold or clammy, those are all signs that it could be an opioid overdose, and you may want to use Narcan in that instance. A lot of times we're seeing fentanyl and other substances. So, if you're not getting them from a pharmacy, so say it's Xanax, marijuana, things that you wouldn't necessarily think of having opioids in them, we're seeing those being laced with fentanyl, and a lot of accidental overdose deaths related to people not knowing what's in their drugs.
Right, right. So having that Narcan on your person is, a great tool in this world we're living in, where the drugs are mixed with all kinds of things, and it's a very scary and complicated situation. So if people are seeking treatment, or maybe they want to find out more about treatment, how can they get in touch with Omni Family Health?
Yeah, so just give us a call. Our phone number is 1-800-300-OMNI, 6664. Or you can check out our website, which is omnifamilyhealth.org. Your local health departments will usually have a phone number to call for your county as well. I would say just reaching out to all those resources is the best thing to do. There's definitely help out there. This is treatable. This is a treatable medical brain disease. And I really want to encourage people, if they're having a problem with this, or someone they love is, to help them get into treatment.
All right. Well, Dr. Grace Tidwell from Omni Family Health, thank you so much for being here today.
Thank you so much.